Hello, everyone. Welcome back to 3 News Now. I'm Stephanie Haney. It's Tuesday, January 19th. Thanks for choosing to be here for the top stories from WKYC.com and our WKYC app. And today we are now less than 24 hours from the inauguration of Joe Biden, happening not long after those deadly riots in Washington, D.C. on January 6th. We do have an update related to the presidential detail and the people who are being charged with protecting the Capitol for the inauguration happening tomorrow. 2 National Guard members have been removed from Biden's inauguration protective team. This is according to a U.S. Army official and a senior U.S. intelligence official who said that these 2 Guard members have ties to fringe-right group militias. Now, these 2 officials spoke on the condition of anonymity to the Associated Press. They didn't say what fringe groups the Guard members belong to or what unit within the Guard they served in. The Secret Service told the AP on Monday that it would not comment on the matter, but according to the U.S. Army official and a senior U.S. intelligence official, the 2 people who reported these Guard members being removed, there was no plot against Biden that was found. Now, for tomorrow, the inauguration will be happening at noon, but it will be a much different inauguration than we've seen in the past for 2 reasons. One, because of the riots that happened at the Capitol on January 6th, and also because of COVID-19 concerns. Now, the events of January 6th have impacted President-elect Joe Biden's plans. He had initially wanted to take the train into Washington, D.C. He won't be doing that now. Instead, he'll fly into a military airbase just outside of the Capitol and motorcade into D.C. And right now, there are about 25,000 National Guard troops guarding the Capitol, the White House, and the National Mall, which is barricaded off, surrounded in fencing. It's a very different visual than people are used to seeing in the Capitol. Biden's first event in Washington, along with Vice President-elect Kamala Harris, will be an evening ceremony tonight at the Reflecting Pool near the Lincoln Memorial. That'll be honoring the nearly 400,000 American lives that have been lost to COVID-19 so far in this pandemic. As for tomorrow, what you will see, where you would normally see people celebrating the inauguration, will be 200,000 small U.S. state and territorial flags that'll be on the National Mall. This is a display to represent the American people who couldn't come to the inauguration, which is restricted, as I said, under tight security and also COVID-19 restrictions. Now, we do have a guide up on WKYC.com for everything you need to know about Inauguration Day. The official swearing in will take place tomorrow, Wednesday, January 20th at noon, when Joe Biden will take the office to become the 46th President of the United States. And Vice President-elect Kamala Harris will be sworn in, and when that happens, she will become the nation's first female vice president, the highest-ranking female elected official in U.S. history, and the first African-American and first Asian-American vice president. The theme for the day's events is America United, and there will be various events taking place throughout the day. Presidential Inaugural Committee CEO Tony Allen said this in a statement. This inauguration marks a new chapter for the American people, one of healing, one of unifying, of coming together, of an America united. Now, you might be wondering if there will be a parade as we've seen in the past. Kind of. This will be televised, and Joe Biden will receive a presidential escort to the White House, and this will be followed by what's being called a parade across America. This will be diverse, dynamic performances across the country in these different communities, and it will all be broadcast as well. We'll be featuring the inauguration live on 3 News, and you can stream it live at WKYC.com and in our WKYC app. Now, as we look to the transition from President Trump to President Biden, you might be wondering, what difference will this really make in the state of Ohio? Well, I wanted to get both the Democratic and a Republican perspective on this, so I talked with our U.S. Senator for Ohio, Sherrod Brown, and also Republican strategist Mahek Cook. She served as the former legal advisor for former Ohio Governor John Kasich in 2016 when he was seeking the presidential nomination for the Republican Party. So that 2-part episode is up right now. It's linked on WKYC.com. You can also find it by searching 3 Things to Know with Stephanie Haney wherever you get your podcasts if you want to check that out. We talk about a lot of issues that are very important to Ohioans: jobs and the economy, who's responsible for the COVID-19 vaccine, which we'll get to just a minute here with Governor DeWine's latest updates about that. Also, the opioid epidemic, which, in case you didn't realize, the state of Ohio is on par to have the most opioid-related deaths that have ever occurred on record in Ohio, breaking the record from 2017. Definitely something that we're not necessarily talking about, but is still very much impacting us here in the state of Ohio. Also, other things like legalizing marijuana. It's a whole range of topics, and you can find that again on the 3 Things to Know with Stephanie Haney podcast. Now, if you're tired of seeing political yard signs in your yard, basically, that's not going to change for you anytime soon because you can't force your neighbors, the city can't force your neighbors to take those signs down. Here's why. Local government can't make you take down a political yard sign just because it's political. So unless cities and municipalities make rules that relate to all yard signs, those signs can stay up as long as people want to leave them up. This is coming up because there are some laws on the books in municipalities that say you have to take your political yard signs down so many days after the election. Well, a 2015 U.S. Supreme Court ruling struck that down because government can't restrict signs based on the content that is on them. That would be a First Amendment violation. Local government does have the power, though, to regulate things like the size of the sign, the material the sign is made of, the location, and the number of the signs on the property, but not related to the content that the sign has on it. Who can ban political signs? Great question. Homeowners associations can ban political signs. The HOA has every right to do so. This is a contract that you willingly enter into when you buy your home. Some of you might not think that you willingly enter into them if you fall in love with a certain home and you want to live in that area, but the truth is you do. It's a contract. You don't have to sign that. You don't have to live there. You can always live somewhere else that doesn't have a homeowners association. So, point is, an HOA is an organization. It's a private group. It's not government action, and the First Amendment doesn't apply. So if you want to live somewhere that can decide when your neighbors have to take down those political signs, you might want to look into a place that has an HOA. Okay, now let's take a look at some of the updates from Governor Mike DeWine's press conference today. As of today, more than 450,000 Ohioans have received the first dose of the COVID-19 vaccine. DeWine says that this rollout of the vaccine at this rate will continue until the Johnson & Johnson vaccine gets here, which he says will hopefully be in March. Now, this week we are entering Phase 1B of Ohio's plan to roll out the vaccine. That includes Ohioans ages 65 to 80 and K through 12 teachers and staff. Next week, DeWine says vaccination will open for Ohioans with certain severe medical disorders that make them particularly vulnerable to COVID-19 and who have a developmental or an intellectual disability. We have more details about that up on WKYC.com and our WKYC app right now. Okay, let's take a look at the latest numbers for COVID-19 in from the Ohio Department of Health. Now remember, yesterday was a holiday, so that can impact these numbers. We are seeing numbers that were up from yesterday, but are down from the numbers that we've been seeing lately. So we don't know at this time whether that's because of the holiday on Monday, because of the lag that we usually see over the weekend, or if the numbers are coming down. But either way, here's the data that we have, and if it is the numbers coming down, certainly that would be wonderful. But in the last 24 hours, there have been 4,989 new reported cases of COVID-19. Now, when we look at the positive rate, this is the number of cases coming back positive, the percent of cases coming back positive from all the COVID-19 tests that are being done. That latest rate that we have is from Sunday, the 17th, and that is 10.9%. The 7-day average is 11%. In the last 24 hours, we did see a decrease in the number of new reported deaths related to COVID-19, still too high at 55 additional deaths reported. We've also seen 254 new hospitalizations in the last 24 hours. That's up from yesterday, but the number of people in the hospital being treated for COVID is down. That's 3,643 right now, and 885 of those people are being treated in the intensive care unit, which is also down from yesterday. We saw 20 new ICU admissions in the last 24 hours. That number is up by a bit. And if you take a look at the number of our beds that are available in hospitals right now to treat people, that is down. That is at 27%, down from 31% available yesterday. Now let's take a look at the national and the global numbers for COVID-19. These come from Johns Hopkins University. Across the U.S., we are now at 24,137,812 reported cases of COVID-19. The total number of deaths, almost at 400,000. That number is 399,828. So less than 200, under 400,000 deaths, which is a staggering number if we think back to what was projected when we first became aware of this pandemic being here in the U.S. We have 4% of the global population in the U.S., but our percentage of cases and our percentage of deaths continues to increase ever so slightly day by day. We now have 25.2% of the global cases of COVID-19 and 19.5% of the global deaths related to COVID-19. Globally, there have been 95,860,637 reported cases of COVID and 2,048,811 global deaths related to COVID. Now, to really bring home how this is a global issue, our 3 News Investigates team talked with helped a person who went to the hospital, went to the emergency room to get a COVID-19 test, was in the ER for 20 minutes, and left with a $2,000 medical bill. This man is Stephen Lee, and he has family here in Ohio in the Orange area, but he lives in Finland right now and is not a U.S. resident. So he wanted to come home for the holidays to see his family, but he wanted to do it safely. So he got here early ahead of the holidays, came here, arrived at an ER, which he felt was his only option to get a COVID-19 test, and they were able to treat him. So he went in there, again, 20 minutes. That was on November 13th. This was at a University Hospital's campus in Beechwood, and then went on his way. And later he was sent 2 bills, one for over $1,100 from University Hospitals and one for just under $1,000 from Alteon Health, which billed for the ER doctor. Now, our 3 News investigative reporter Rachel Polanski called University Hospitals to see who she could talk to about the bill and get to the bottom of this. They said they would call back, and then a few days later, they agreed to reduce that bill by $400. So taking that down to about $700 of a bill for Mr. Lee. Now, the other bill, when that was investigated, it turned out that it was going to be paid by travel insurance. So Lee didn't have to pay for that bill. But what Lee told our team is that he thinks it's wrong to charge $2,000 for medical care and not inform people up front. And I think a lot of people would probably agree with that, especially when you think about spending just 2 minutes in a facility or 20 minutes, not 2 minutes, but 20 minutes in a facility for a test. Now, there is some good news here. There is a measure that is supposed to help end surprising medical billing. It passed in Congress at the end of 2020. It's supposed to take effect in 2022. Now, it's certainly not perfect, but it does address some issues, like when you go to a place that is in network, but you end up being treated by someone who is out of network. Any discrepancies in those billing, it would do away with that. Also, if you have a dispute, it calls for the creation of a dispute resolution process between the patient and the physician. Again, some changes, certainly not perfect, but some changes on the way, effective 2022, so sometime in the next year or so. Of course, we will report on that as that comes out over the next year or so. Now, conversations looking forward for the Cleveland Browns, which had the heartbreaking season-ending loss to the Kansas City Chiefs on Sunday, are now turning to contract extensions, and one of those people includes star running back Nick Chubb. This is following his 3rd season in the NFL, and he'll be eligible for a long-term extension. So when he was asked about it, Chubb said that he hadn't given the subject much thought, that he's still thinking about the game on Sunday, and he's just not really looking forward to that stuff right now. He said he's just continuing to work, and it'll pay off for him eventually, and we will see. But people are speculating about it. Spot Track projects sports contracts, and they are projecting a market value extension for Chubb would be a 4-year deal worth about $48.5 million. That would be an average annual salary of about $12.1 million. Now, that doesn't factor in guaranteed money or bonuses. And this is based on statistical analysis of 4 players that SpotTrack considers comparable to Chubb, who recently signed new deals. Those players are Derrick Henry of the Tennessee Titans, Joe Mixon of the Cincinnati Bengals, Melvin Gordon of the Broncos, and Dalvin Cook of the Minnesota Vikings. Here's a potentially complicating factor, though. The Browns have already signed Kareem Hunt to a 2-year, $12 million extension. That keeps him under contract with Cleveland through 2022. Paying both running backs a significant salary could be questionable in the Cleveland Browns organization. Although if you've been watching the Browns this season, you know Nick Chubb is the man to get the job done. So that's my vote. If I'm putting a worm in the ear of anybody in the Cleveland Browns organization, it's do not let Nick Chubb go. Whatever you have to do to keep him, do not let number 24 go. That's all I'm saying. Okay, the Cleveland Cavaliers' new banner downtown is up. This is that banner that says, "For the love, for the land." This is a big old banner. It's 210 feet by 110 feet. It's got the different hands of the people of diverse backgrounds placed on a basketball. One of those hands featuring a 2016 NBA championship ring. So the banner is supposed to symbolize diversity, inclusion, and equity in the community. The Cavaliers have said it's an invitation and a rallying cry of action to embrace unity, come together in a common bond for love for each other and our city. And it is up now. It looks great. It's on the Sherwin-Williams Global Headquarters right downtown by Rocket Mortgage Fieldhouse where the Cavaliers play. And I have an answer to the people who were wondering, whose hand is that with the NBA ring on the basketball? I sort of have an answer because people were wondering because the hand featuring the ring is a hand with dark skin. And there is nobody currently on the team who is dark-skinned who played on the 2016 championship team. Well, it's not a player. The people whose hands are on that basketball, according to the Cavs PR team who told me today, they are all hand models. Sorry to break it to you. Not an actual player with that ring on the hand, but pretty cool for that hand model who got to wear at least a mock-up of a 2016 NBA championship ring. And before we let you go here, we've got to say a big happy birthday to Dolly Parton, who is 75 years young today. Dolly Parton continues to save us. She donated $1 million to Vanderbilt University to help finance the research that brought us the Moderna COVID-19 vaccine. She has literacy initiatives. She has donated money for people to help them out after they've lost their homes in fires out on the West Coast. She is just a blessed woman, and we are lucky to have her here and so glad that she's around still making the world a brighter place. And on her birthday today, she tweeted out that what she wants is a call for kindness. She says we can't just hope for a brighter day, we have to work for a brighter day, and that love often gets buried in a world of hurt and fear. So today, January 19th, let's get to unearthing love. So what she is asking of people to do today, if they are so inclined, if you can, do something for kindness. Donate to a cause. If you're able to, raise your hand and do some volunteering. Call an old friend who you haven't spoken to. Those kinds of things. Dolly's parting words were, "Love is more contagious than a virus, so let your best self shine in a glorious light, and others will be inspired by you." Sage words from that magical woman herself. All right, that's it for your 3 News Now update for Tuesday, January 19th. Everyone enjoy the rest of your afternoon. I will see you next up on What's New at 5 p.m. with your trending stories in the Clicking in Cleveland segment. Everyone stay safe and be well, and I'll see you back here tomorrow. I'm Stephanie Haney.